Dr. Brian Long coming to you from the Barrows Chiropractic and Wellness Clinic in San Antonio, Texas. Today I want to talk to you about an extremely common condition we see here in the office, chronic low back pain or lumbago. This typically stems from either strained muscles in the low back, damaged ligaments, spinal abnormalities, or even small fractures in the spinal vertebrae. Factors like obesity, poor posture, lack of exercise, arthritis, improper lifting or bending contribute to back misalignments and pain. There are several common causes and risk factors that can lead to the development of chronic low back pain. One of the most frequent contributors is strained muscles in the low back from either overuse, improper lifting, or a sudden awkward movement. When back muscles or ligaments become overstretched or torn, it triggers a painful muscle spasm and inflammation. Weak core muscles that provide insufficient support to the vertebrae and discs can also contribute to back strain. Spinal conditions like degenerative disc disease, scoliosis, spinal stenosis, and herniated discs often result in chronic low back pain. As we age, our discs become less flexible and therefore absorb less shock. This can lead to painful rubbing of the vertebrae. Narrowing of the spinal canal or compressed spinal nerves from bulging discs also lead to back and leg pain. Arthritis and osteoporosis change the structural integrity of your vertebrae, which contribute to spinal misalignments. Obesity and excess weight lead to increased stress on the low back, which increases wear and tear over time. Poor posture from slouching, bending, or sitting without lumbar support strains the back structural integrity. Lack of physical activity causes back muscles to be tight and weak. Occupations that involve repetitive lifting, bending, or prolonged driving increase your likelihood of experiencing chronic low back pain. Chiropractic care focuses on the link between the spine and the nervous system. We use, as doctors of chiropractic, we use either hands-on or instrument-assisted spinal mobilizations and manipulations to realign the vertebrae. This relieves pinched nerves, restores mobility, and activates the body's natural healing abilities. Multimodal plans that we use in the office, like we use in the office here, also incorporate rehab exercises, soft tissue work, and lifestyle counseling. Specifically, we use nutritional counseling. In addition to manipulation, our hands-on soft tissue therapy include cupping to decompress the tissues. We use percussive therapy to increase blood flow and decrease inflammation. And occasionally we also use kinesiotaping to decrease inflammation and provide a little extra support. Addressing muscle tension, scar tissue, and restricted joints through these methods help improve spinal mechanics. We also recommend rehabilitative stretches and exercises outside the office to increase your progress. Overall, chiropractic techniques make it effective for relieving acute back pain as well as correcting the underlying joint dysfunctions. So what are the benefits of chiropractic care for lumbago? So the first is one, what most people think of when they go to a chiropractor is pain relief. Chiropractic adjustments directly target the sources of back pain for fast relief without medication. Next, it increases flexibility. Spinal adjustments enhance mobility and range of motion in the back. It provides postural improvements. We assess posture issues and teach proper spinal alignment. It leads to stronger muscles. The recommended exercises strengthen the core muscles to support the spine. And lastly, injury prevention. Routine adjustments prevent flare-ups and re-injury. Experienced chiropractors tailor care plans on factors like age, injury history, occupation, symptoms, and lifestyle. For example, a young athlete with an acute low back strain from playing sports would likely benefit from gentle massage, cold therapy to relieve the spasm, along with their targeted spinal manipulation. On the other hand, an older patient with chronic arthritis would likely need the frequent but less forceful mobilizations and stretching exercises in addition to the adjustments. While chiropractic adjustments provide short-term pain relief and joint motion, addressing the underlying structural causes of chronic low back pain requires ongoing and a multifactorial approach. During your initial treatment, you could be seen up to 2 to 3 times a week as an intensive treatment to reduce inflammation, decrease pain, and improve joint mobility. Gradually, as your symptoms improve, the frequency will decrease. But however, most patients benefit from maintenance care even after the acute injury has been resolved. Ongoing chiropractic treatment helps sustain motion and prevent recurring injury and catch small problems before they become big ones. So lumbago is an extremely common and painful condition, but there are effective solutions available. Chiropractic care delivered by trained professionals can correct spinal misalignments and provide lasting relief combined with complementary lifestyle changes. I'm Dr. Brian Long. I'm in the San Antonio area. If you're in our area, we provide free consultations. We'd love to see you. The link to our website's in the description, and you can schedule online. And as always, like, share, and subscribe.